Good afternoon, everybody. There's a few people still coming into the call, but we might kick off. Absolutely, really respecting your time this afternoon. Fantastic that you're able to join us. My name is Katie Billing. I'm the Executive Director for Consumer and Clinical Partnerships at the Commission on Excellence and Innovation in Health. I have to draw a breath after that one. It's fantastic that you're able to join us today. Before we go any further, I want to acknowledge that myself and my colleague Kimberly and I are sitting on Kaurna land here today. The dreaming is still living from the past, in the present and into the future and forever. We'd like to acknowledge Kaurna people. I'd also like to acknowledge the lands that some of you may be joining us from today, and any Aboriginal and Torres Strait Islander people who are in the call. So, before we start, just a little bit of housekeeping. So I have some instructions to say that the session has been preset to keep your mics on mute, so you don't have to worry about that. And the video feed has been turned off by default, but this will be re-enabled during the question and answer time after the presentation. Really importantly, and this is consistent in all of our sessions, that only the presentation is recorded and published, and the recording is stopped for question time so that we can turn on those cameras, open up and have a really robust conversation with our presenter. For the Q&A, you can use your mics or the chat function to ask questions. Absolutely would love you to turn your cameras on so we can see your smiling faces as well. Finally, after the Q&A, there's a quick survey for you to complete, and also some other information that we're going to share in the chat. So stay around in case there's a goal after the siren. Don't run off when you think it's about to end. We'd appreciate you just taking just a moment to fill in just a couple of quick questions. So the Commission on Excellence and Innovation has a vision together, creating health and prosperity for all. We're an attached agency to SA Health, and we're the lead agency for innovation in healthcare in South Australia. We're all about bringing people together and connecting the dots, and we do our work in support of the health system. It's all about bringing people together so we can imagine and think about new and better ideas for the future. We acknowledge that better isn't always excellent, but actually what we're aiming for is that committed improvement to being able to measure what we're doing and continue to improve so that we can understand the impact that we're really having. So what if the big idea was connecting all of the small ideas? Well, that's really the essence of why this showcase kicked off, was to suggest that actually there's lots of fantastic things happening across health and really an opportunity to help connect people in SA across the sector, and sometimes across states and internationally as well, to be able to just share ideas. Doesn't have to be about sharing ideas that are well polished or published, but absolutely about being able to share where things are changing and improving. So we run these 40-minute sessions online and make them available for those that are registered and then would like to have a look later on, sending through those links, but also we're able to do a bit of an edit, cut out the mistakes that I make and pop it onto the website as well, so that they're there into the future as a resource, aiming to really provide that space to explore what others have learned. We're also trying to keep it simple. So this is not about necessarily academic presentations. We're really keen in our improvement and innovation showcases to provide that platform for people who say, hey, we saw this problem, it didn't work. Perhaps we learned something while we were trying. So just a quick prompt. If you've got a story to tell, if you've succeeded in solving a problem, if you've learned something whilst trying, or if there are themes that you'd like us to explore in our future improvement and innovation showcases, then we'd really love to hear from you. Please get in touch and we will get back to you via the contact email address that's on the screen, or just use Google and the Commission on Excellence and Innovation in Health. Now, a little bit unusual today, we host these sessions in themes, and today is the first in the series of our new theme, and we've got our guest theme host who we're partnering with me today, and that's Dr. Kimberly Humphreys. I'm going to introduce Kimberly firstly to actually share a little bit about the theme, and then I'm going to have an opportunity to also introduce her as the speaker for today. So I'm going to introduce Kimberly twice. This time I'm going to throw to you, Kimberly, though, to talk about the theme.
Perfect. Thanks, Katie. Yes, so as mentioned, our theme is environmental sustainability in healthcare. And as Katie mentioned, I'll be speaking on the first part of this series today and really trying to give you an overview of sustainability and climate change in healthcare, which, as you appreciate, is a huge topic. So we'll just be touching on a lot of things that we'll explore in greater depth throughout the series. So the other sessions that we have are on high value, low carbon healthcare, which is a really critical part of what we need to do. We're also going to be having a couple of guests who have done some great work within the local health networks on sustainability, and also facilities management and the move to the new women's and children's as well will be wrapping up at the end. So lots of exciting things to explore over the coming weeks. And I'm going to pass back to Katie.
Fantastic. So throughout the series, Kimberly, I understand that we do have an opportunity also to promote the opportunity to provide feedback on the SA Health climate change framework. And so that's a really exciting thing. We will be promoting that throughout this series. So on your screen at the moment, there's a QR code. If you're watching from your phone, it's really tricky to do that, I've learned. But an opportunity for you to jump on and have a look at that as well. So that's fantastic. And Kimberly, you just mentioned that in this series we have the 4 presentations. So we have on the 6th of June, which is today, yourself, Dr. Kimberly Humphrey, who I'll introduce shortly. But then 13th of June, Dr. Kate Charlesworth, as you say, on that high value healthcare and low carbon healthcare. 20th of June, waste reduction healthcare with Sarah Ripley and from Women's and Kids, and then from the New Women's and Children's, Jack Noonan on design in healthcare. So a fantastic series, all the way hoping to be able to hook you in, and hope that you'll be able to join us for the next one, and also have the opportunity to promote the consultation that's going on around the framework as well. So having completed the formalities of introducing this series, I'd like to introduce today's speaker, which happens to be Dr. Kimberly Humphreys. I'm finding this very entertaining, but that's okay. So Kimberly is an emergency medicine specialist, public health medical consultant, and climate change, plus a climate lead at SA Health in Adelaide, Australia. She is the 2022-2023 Fellow in Climate Change and Human Health at Harvard University. Kimberly is also a board member for Doctors for the Environment Australia and immediate past deputy chair of the Council of Advocacy, Practice and Partnerships at the Australasian College for Emergency Medicine, board member of the Australian Board of the Medical Board in there, and is a clinical senior lecturer at the University of Adelaide. Kimberly has a specific expertise in research, policy and advocacy at the intersection of climate change and health, emergency medicine and public health, and disaster mitigation and adaptation. She's passionate about driving research in community and health system adaptation to climate change impacts, reframing our health system toward high quality, low carbon care, and assessing solutions to build resilience as a part of climate change adaptation approaches. Mostly, she's focused on rethinking the status quo because it isn't working for all of our society, and looking towards greener, healthier, happier, and more equitable communities and cities. Kimberly, welcome.
Thank you. Thank you so much. Okay, just bear with us while I try not to mess up the tech and try to make my slides work properly. Thank you, Katie. Okay, let me see if I can get this to do what we want it to. So as I mentioned, oh, look at that, it's even working. This is a huge topic. Now, I know some of you who are on the webinar today will have very specific interests within this topic, and that's fantastic. We may not explore all of the things you want to talk about today. As Katie said, there'll be time for question and answer, but I'm always very happy as well to be emailed to have these conversations too. So I'll pop my email address up at the end. I'd like this to be the beginning of engagement with lots of you on this really crucial topic as well. Okay, so climate change is huge problem. The Lancet calls it the biggest global health threat of the 21st century. So that's really the crux of the presentation today. Is I hope all of you walk out of this webinar understanding how this intersects with your practice, whether you're clinical, wherever you work in health. This is the problem of everyone who works in healthcare, and it's going to be something we all need to understand, and also understand our part in the system and what we need to do. So as mentioned, we have the climate change framework, which is really the first step along our journey as a health system to tackling this big problem. So this is a very high level, just kind of goals, doesn't get down into the nitty gritty of exactly what we need to do, but it's our guiding kind of framework as to where we need to go. So that's out for consultation at the moment. So public consultation is open for another few weeks, and I would love it if any of you who are keen can get on the website. You can Google it as well. You didn't get the QR code. So you just go to that page and Google the climate change consultation. You can provide your feedback. So just very quickly, these are the goals that we're looking towards as a health system. So environmentally sustainable, net zero in all of our areas. So that's not just buildings, that's also our service delivery and our culture, so that we all act in a way that's consistent with that principle. That we have a health system that's climate resilient to the impacts of climate change. Once again, that's not just buildings. That's that we understand our role, that we're protecting our workforce, that we're thinking about our supply chains and how things get to our hospital and all of the different parts of that. And that with all of this, we provide high quality health services for patients and communities. So these things actually go hand in hand, and I'll explore a little bit more how that is as we go through. We have 8 key priority areas under that framework. So from leadership and governments through to the things you might typically think about that are electrifying buildings and fleet vehicles and how we deal with our waste and all of those things, through to our workforce and also looking at adaptation and climate resilience and how do we assess the risk to our populations and our hospitals and our people as well. So these are the key priority actions, and then we have a number of different themes that sit under that. And I'm not going to go through this in any more detail. This is more to highlight this is a piece of work we're doing and the beginning of what I think is going to be a really exciting journey. Okay, so now we're going to delve into the quite deep, meaty stuff. And I think you're going to find this is really a maybe hopefully not too exhausting, but pretty full-on crash course through climate change and health, which is just a massive topic. The reason I'm doing it this way is I'm assuming some of you will be educated on this, understand how climate change impacts health and all of those things. But I'm also thinking that there will be some people on this call who maybe don't and could use a little bit of that background and a bit of a refresher as well. And I think will be a good lead in for the rest of the series about why this is important and why it matters to all of us working in health. I'm not going to talk very long at all about the science. It's not really up for debate. So we know that we are experiencing a warming climate and that it's caused by people. There's a lot of evidence, a lot of literature to support that. As this graph shows, it's quite pronounced since the Industrial Revolution, and now we're seeing really market effects all around us all the time. We know that we're not where we need to be in terms of limiting our warming. So all of the implemented policies, everything that's been announced by countries in all of the commitments that they have to make internationally, that still amounts to more than 2 degrees. Now, the magnitude of impacts at 2 degrees is incredibly significant. If we can keep warming to less than 1.5, it's still more than we're seeing at the moment. It's still more fires, it's more hot days, it's more floods, it's more of all of those things, but a magnitude less than it is at 2 degrees. So it's really important, whilst we still have the time to make these changes and to try and hit that 1.5 degree mark, that we do all we can. And that's really why I've got this slide up here to just remind us of the job that we still have to do globally, as well as within the healthcare sector. So a couple of things just to mention about Australia, because occasionally this comes up. We're not a terribly big country. We don't have a terribly big population. The impact we're making on a global scale negatively in terms of carbon emissions is pretty big. So if we're looking at fossil fuel exports, which really needs to be part of our carbon footprint as a country, we're third. So just after Russia and Saudi Arabia. We are exporting a lot of fossil fuels that are leading to pollution when burned in other countries, but really that's on us as well. So there's a problem there. Secondly, our carbon dioxide emissions per person are really high as well. So you can see we're right on the left there, so more than the USA, Canada, Russia, China, European countries. So what we are emitting per each person in this country is pretty significant. Now, this talk isn't going to be about what you need to do and how you need to drive an electric car or all of those things. It's more just to remind us that what we do as a country matters, and what we do within our healthcare system is a big part of that as well. So we know that healthcare is about 7% of Australia's total greenhouse gas emissions. So that's not insignificant. And we've got a degree of work to do in cleaning up our own backyard. Globally, we know that healthcare, if we consider it as a country, so if we put all health systems together, we'd be the 5th largest country in terms of emissions. So it's pretty significant what the health industry emits. Now I'm going to move on a little bit to talking about the impacts of climate change. So we've talked a bit about the problem and our contribution to it. What is this doing to Australia? So many of you will have lived experience of these things. We are seeing increase in extreme hot days, so more of them, more often and lasting longer. We're seeing more extreme precipitation events. So whilst we're getting less rainfall in lots of the country, we're seeing more of those really intense short events, which are quite problematic for our infrastructure, for our drainage, for how we manage our cities and our metro areas. And we're also seeing more extreme fire weather days as well. And that's not to mention things like coastal flooding and ocean acidification and the health challenges of those things as well. So we're already seeing this. This is not an abstract problem. We know that warming is at about 1.3 degrees now, and we are seeing the impacts on our patients across Australia already. So this is here and this is now. If we're talking about the health impacts of climate change, there's a few ways we need to think about it. So we've got our exposure pathways, and those are things like the very hot days leading to heat-related illness. It's the air quality. Now that's related to climate change because some of it's from air pollution, but some of it is caused by climate change. And there's some intersections between pollution and climate change as well that lead to respiratory problems. We'll go through that in a little bit in a few more slides. We also have things like food security and water quality and quantity and scarcity. We have a changing distribution of infectious diseases. So where our mozzies like to live is changing. How long they live, where they breed, all of those things. And that means that the diseases that they carry are impacting different populations now. We also see the impacts of extreme weather events. So whether it's a flood or a bushfire, whether that is burns or traumatic injuries to people, or whether it's mental health impacts, all of these things are things that we are seeing through these exposure pathways. Intersecting with this is the fact that climate change doesn't have equitable impacts. So it disproportionately affects those in our community who are already suffering in many ways. So people who are living in poverty, people who have poor social determinants of health, people who are living in our regional and rural areas, people who have all of the people who are most exposed to vulnerability. Climate change is a multiplier of all of those things as well. And then the other part that intersects into this is our health system capacity and resilience. So what have we built into our health system in terms of workforce, in terms of our leadership and governance structures, our buildings, all of these things? What have we built in that can help us protect our populations against climate change and decrease the effects and really build healthier, stronger populations that we know will better weather these events as well? So there's lots of bits that go into every person in our community and how vulnerable they are to climate change impacts. So what we will do as we go through this is we'll explore some of these specific health impacts, but we're also going to talk about what we need to do within the health system a little bit, but these are very big topics that could have their own webinar, and some of them will. And we're going to talk about the adaptation that we need to do as well. Okay, so I'm going to talk about heat for quite a little bit of time because this is the big one, and this is the one that many of you are probably most familiar with. Now, I'm very aware of the fact that we are a mixed audience today, so some of you will have job roles where you are interacting with patients every day. Some of you may be providing healthcare in a way that means you don't see a patient one-on-one, or intersecting with the health system in a different way. And I'm just going to try and make this as general as I can, and hopefully there's something that you can take away to your practice from some of this today. So heat. Each of the last 4 decades have been warmer than the one before. We know this is the most frequent cause of extreme weather-related injury, hospitalisations and deaths in Australia. And we know it's the biggest climate change, extreme weather-related cause of morbidity and mortality across the world. So this is a big problem. In many ways, we're well placed to deal with this And we have some really good systems in South Australia already set up to be able to do this. We have good heat warning systems. We have structures set up like the Red Cross who'll get in touch with people to make sure they're okay on a really hot day. And I think a pretty good understanding of the risks of heat in many ways. That's not the same across many countries in the world. Now, I haven't talked very much about impacts in other countries because I've tried to make this pretty specific for our audience today. But the one thing probably to understand is what I've said about climate change disproportionately affecting certain communities in Australia. We can look at that more broadly and globally. So climate change will disproportionately affect the poorest countries in the world, the global south. Many of those places, and you may have seen India, for example, hitting 50 degrees. Many people in many communities across the world live in places where they don't have access to air conditioning and they don't have plans and they don't know what to do and they have nothing they can do. So this is a really big problem. We know that last year was the hottest year on record, and every month we just kept seeing that record being smashed. So hottest, 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 just keeps escalating. This is a graph of how number of days of extreme heat are increasing across Australia over time. So we can see from the early 1900s through to today, we're seeing a lot more really hot days. I just want to briefly talk about the specific impacts on the healthcare system. So this is just an example, and if you delve into the literature, you'll see examples of this locally from Adelaide, across all of our systems, internationally, etc., about what heat does to our system in general, not just to the individual patient. So January 2014, there was a run of really hot days. And what was seen there was a 25% increase in ambulance call-outs, a 7% increase in all hospital presentations to EDs, and that was almost 23% in patients who were older than 75. We saw 858 deaths, which was about 167 more than expected, and 3 times as many heat-related calls than expected to primary care services at that time. And you have to remember that January 2014, we didn't have a lot of the virtual care infrastructure we have across Australia now. So the way that people were interacting with the system was a little bit different. And so there was a lot of kind of calls to GP after hours services and things like that. It's really important to realise as well, and this is a big challenge with heat, and I speak on this point from my experience as an emergency clinician, is it's easy for us to pick up the patient who has obvious heat-related illness, who comes in and they have heat stroke. I was trained to tackle that in my fellowship training for emergency medicine. What none of us are really able to do, no matter what specialty we are, is to say whether or not many other presentations are related to heat. Now, we know that heat has impacts on all of the body system. So it increases your risk of heart attack and stroke. It has impacts on the kidneys. It intersects with lots of chronic diseases. But it's very difficult for us to say someone coming in with a heart attack would or would not have presented if it wasn't 45 degrees. Unless they've come from a house that, you know, the ambos have said, well, yeah, no, they had no aircon and it was so hot. Other than that, it's very difficult for us to kind of unpick that more indirect presentation as well. So it's likely under-reflected within presentations exactly what we're seeing as a result of heat. Briefly going to mention wet bulb temperature, which is a big issue in a lot of places in the world, not so much for us here, and that's because this is a reflection of humidity. Now, we live in a place that's pretty dry. A lot of people live in places where when it's hot, it's pretty hot and wet. And when it gets hot and wet, that really impedes, there goes our lights, that impedes the body's ability to be able to sweat. And so the level at which you get in trouble and become really sick is a lot lower because sweating is our body's primary mechanism for getting rid of heat. So then we find that we need to adjust what we're doing. And this, unfortunately, this is Fahrenheit because this is a US chart, so it doesn't really correlate with what we see. But what this is basically saying is when we're talking about wet bulb temperatures, which is the humidity and temperature together, it may not be that hot. Actually, it may only be 30-something degrees. But the recommendation may be no sport because you're just not going to be able to get rid of the heat and your risk of heat-related illness is a lot more at lower temperatures. Just something to be aware of. Another really important thing is understanding the concept of urban heat islands. So when there's lots of green space, it dissipates and reflects the heat and it makes things a lot cooler. When we have areas that are a lot of pavement and concrete, then we find that heat is really concentrated in those areas where there's not a lot of vegetation, and they can be a number of degrees hotter. And I'm sure many of you have had that experience where you've walked through a car park or walked down a road where there's not trees and it's a hot day, and it feels very different to how it feels under the shade. One of the things that we know is true, and this has been seen internationally as well, is that what we've tended to do as societies is concentrate this green space in higher socioeconomic areas. And then our lower socioeconomic areas, where many people are grappling with lots of problems such as cost of living and already having maybe many more health challenges and bits and pieces, we haven't invested in green space in those areas, making those communities even more vulnerable to the impacts of heat. So this is a really important thing that I think really speaks to how health needs to be across all of the different sectors. So things like urban planning, we need to be able to advocate for, yeah, we need trees, not just because they look nice and clean the air, but they cool down spaces and make our communities less vulnerable to heat. It's an adaptation mechanism. So heat waves will disproportionately affect a few groups of people. So young people and old people, and that's due to the body's physiology, but also in older adults as well. They're more likely to have health conditions that make them more likely to have heat-related illness. We know that our Aboriginal communities and other multicultural groups, for various reasons, many of them due to social determinants of health, are more vulnerable as well. People working outside, playing sport. We still haven't caught up as a community with maybe we don't play our sport in the middle of the day or have festivals in the middle of the day. I don't know if anyone went to WOMAD, but that was a very hot day. We'll be seeing more of those. We're not really at the point yet of considering, do we actually need to change what we do as a community? We'll be seeing these impacts of climate change no matter what we do for probably decades to centuries to come, and we need to really think about that. As I mentioned, people who have medical conditions as well, and people who are, you know, sleeping rough, who can't afford their electricity bill, all of these people are more likely to be impacted by heat. We've touched on many of these things. So heat direct impacts intersections with lots of chronic diseases, more likely to go to hospital and things like that. We also see an increased rate of gender-based violence and violence in general. We see more aggression and more mental health presentations as well. We see things like increased drownings because people are going out to the water because it's so hot. We see more work-related accidents. We actually see more food and waterborne diseases too, because people may not be able to or may not be doing what they would usually do with hygiene and you know, perhaps they're leaving things out of the fridge or don't have a fridge and then are consuming that food as well. And then we see the impacts on infrastructure as well, so power failures, water transport, all of these things, and decreased productivity because it's really hard to work when it's really hot. So this is a big problem for health in general. Managing the impacts of heat, it's a lot of things that we need to do. So we need to get out and talk to other sectors. And I say that broadly within health to really advocate for what we need to do to protect our communities. Heat health warning systems are really important, but so are things like thinking about where do we have that people can go when it's hot and they don't have an air conditioner. So there's been some great trials that have been done. There was one recently in Campbelltown that look at, for example, using a rec centre or a library. And it's air conditioned and we provide resources there, maybe information, maybe even provide things like links to GPs and do a bit of preventive health management. What can we do to really address that and build resilience in our communities as part of providing cool spaces for people to go? Then there's education and risk communication. What do we need to do through our GPs, through our emergency departments to educate people about their particular risk? So we're doing a piece of work around that at the moment. One of the things is if someone comes in, let's say they have heart failure and they have lung disease, they're not terribly sick. They'll probably go home. What can we do at that moment as a brief intervention to stop them being critically unwell next time? Is it that we go, actually, you know, it's approaching summer, more likely we have heat waves, you're on a diuretic, we're going to talk about your specific plan. So we're looking at developing resources that will make it easier for clinicians who are very time-strapped a lot of the time to be able to empower their patients to be more resilient as well. Okay, the other sections are shorter, I promise. That's the big one. So respiratory impacts we'll briefly touch on. So pollution's a big problem. Once again, we're very protected in many ways in our little bubble in Australia, but 6 million deaths a year associated with air pollution. Nearly 93% of people across the world breathe polluted air. So we're actually really lucky, many of us, most of the time, to live in places where this is not our reality. There are intersections between air pollution and climate change that have impacts on health as well. So we find that air pollution has its own whole list of things, and they're all listed on the left there, that have direct impacts on health. But also there are interactions between increased CO2, between temperature, changes in pollen seasons, that increases asthma, makes you more likely to have hay fever, has big interactions with things like thunderstorm asthma. So how thunderstorm asthma works, and some of you may recall this was a big thing in Melbourne a few years ago, is you've got, for whatever reason, and we won't delve too deeply into the climate change causes of this, but you have vegetation that is pollen bearing, and then you have a storm event that raises all of that up into the air. And people who are susceptible to that, who have reactive airways disease, can end up dying and really, really sick in hospital as well. As our pollen seasons change, we're more likely to see more of that, particularly combined with more likelihood of extreme weather events. So we see increases in plant growth, we see increases in the amount of pollen, we see earlier and longer pollen seasons, we see changes in where it is as well. We will notice, because the weather is changing, our plants are doing different things, they're flowering at different times. Some plants are more susceptible to the impacts of climate change than others are, and we'll see that things change, and with that, we see changes in things like pollen and the impacts on people's health. Bushfire smoke is another big one. So this is from the 2019-2020 bushfires. So this was just a survey that was done mostly on the East Coast, where over 50% of people said they'd been exposed to smoke. Now, there's a number there that had other impacts as well, so mental health impacts, or they had to leave where they were. But this is a real problem, and smoke has pretty profound impacts on the lungs. So we know it has direct impacts on the lungs, also systemic inflammation, cardiovascular disease, and also gets through to the brain as well, goes through the barrier and can cause impacts on neurons too. So there's lots of things we don't necessarily think about when we're thinking about smoke. We know that certain groups are more vulnerable to smoke. One of the things that's coming out now is we think that smoke doesn't just have acute short-term impacts. We actually think that the impacts of smoke are persistent and they're cumulative. So the more that you are exposed to smoke, the more problems you are likely to have on an ongoing basis as well. So this is another thing we really need to think about. And we're not brilliant at tackling this, I don't think, yet. So we don't have, there are some really good air quality apps you can get that will tell you what it's like outside. In the US, when I was living there, it's actually on the iPhone weather app. It will tell you what the air quality is. Now, that can be very useful in terms of when do I wear an N95, for example. We will really, I think, need to do more education around this when there is smoke in the air, when we have had bushfires, getting people to wear a mask and understanding why that's really important, and the thresholds for doing that as well. Because we know that a lot of our population, many of us, and even young, healthy people, depending on what the air quality index is, should be wearing a mask when there's smoke in the air. Okay, infectious diseases. This is another big one. So climate change, increasing the temperature, increasing carbon dioxide. We've got extremes of weather, we've got flooding, we've got all these things happening, which change where all of the bugs live. And so we see changes in where mosquitoes live. We also see changes in the pathogens themselves. So how viable they are, where they can get to, where they are best breeding and multiplying as well. And then we see new cases and new infections in different areas as well. So we've seen this in our system with Japanese encephalitis as an example. Never seen that in the southern parts of Australia before. And that's linked to climate change. We'll see more of that. And in many ways, we're not equipped to deal with that. We don't think about it when we're working clinically a lot. In Adelaide, we don't think really all that much, could this be dengue? Could it be malaria? Sometimes we do, particularly in a return traveller. But as these things change, we're really going to need to be thinking about future-proofing and what could this be? Even if we've never seen a case of it here, could it be something like Japanese encephalitis? Things are changing. There's been some good research done which has linked the impacts of climate change on human diseases. So this kind of beautifully messy looking diagram, basically what it's coming out and saying on the right-hand side there is they've identified 76 viruses, which they think are impacted in a scientifically measurable way by climate change, 69 bacteria, and then we go down to fungi and protozoa and things like that. So we know that climate change is interacting with many of these things and changing things. Malaria and cholera and dengue are the big ones that are influenced by this, but there's many, many others. And if you do a bit of a dive in the literature, we could talk about, pick an infectious disease, we can talk about how it's changing because of climate change, leptospirosis, melioidosis, all of these things which we may not be completely across in our system. We need to be thinking about these things at least. Extreme weather events and direct trauma is another big one. So I told you this is a very meaty topic. We have a lot of more extreme weather events. So this is 2023. This is what we saw. We saw extreme rain. We saw extreme heat. We saw a few heat waves, fires and floods. So we're seeing these compounding crises now where you have a fire and a heat wave and then a flood. And the community doesn't get a chance to recover and bounce back before they hit with another one. We'll see more of this as well. These impacts have very persistent and real impacts on communities. We know insurance is going to be a problem. This is more just to say that these are real things that are happening to people. In South Australia, we're looking at 2030. I think about over 3% of properties won't be able to be insured. Now, this might be fire, it might be coastal flooding, it might be any of these things, but the risk is increasing for many of our communities. And then there's some big decisions to be made by communities about what do we do to best protect communities and health? Is that relocation? Is that reinforcement? What does it look like? Mental health impacts, huge. So extreme weather events have their own sort of bundle of terrible things. So trauma and shock, PTSD, etc. But we see increased rates of suicide. We see aggression and violence. We see people who maybe they're in domestic violence relationships and they can't leave because they've had impacts of extreme weather and it's just made everything that much harder. We see people who are working within health who have to live through these things as well as treat their patients, and think about what that looks like when you are worried about your family, community and house due to fires, etc. But you've got to go to work and look after people. That's just really pretty profound. And we know that there's eco grief and eco anxiety in the population as well. This kind of existential angst about, oh my goodness, what do we do? Nutrition as well. I'm not going to dwell too much on this one, but just to say that this is a problem in Australia as well. And so food security and access to food and access to healthy food is a problem. And we see this already in our regional and remote areas where if you want fresh fruit and veg, way more expensive than getting a packet of chips. As things change and it's harder for us to grow these things, to perhaps transport these things, then that's going to have a more pronounced impact on people as well. So what do we need to do? We need to adapt our health sector and our community. I'm not going to spend too long talking about this part, but this is a really big one. And this is the role of the health community to advocate for fossil fuel reduction. So there was a World Health Assembly in the last week where there was a presentation about how the burning of fossil fuels is the biggest public health emergency that we have. And we wouldn't stand by and not say something about other things like tobacco smoking or not wearing seatbelts or things like that that have such a profound impact on health. The best thing for all communities worldwide in terms of health is if we reduce fossil fuels in terms of air pollution, but also climate change as well. So it should be a big public health priority. And then we need to look at what we're doing as a health sector. So adapting can mean building back better than before. I hate using that terminology, but it can. It shouldn't just be about how do we patch things up. It should be about rethinking where we want to go and maybe using climate change as a lever to get there. Looking at building climate resilient systems. So that's addressing all of the puzzle pieces. So that's looking at leadership and governance and workforce and our data and our service delivery and all of these different things, seeing where the risk is, seeing how we can adapt and seeing how we can actually use maybe climate as an argument to address some of the big problems we have in our community. So inequity, overcrowding in our hospitals. In many ways, we can use climate to address lots of these things. And lots of the things we do can reduce carbon emissions and make our communities healthier and more resilient as well. So green space and active transport is a really good one. People are out there and walking around because it's lovely and green and cool. Then they're not driving their cars, decreasing carbon emissions. They're becoming healthier, decreased obesity, chronic disease, etc. Then they're more likely, for example, to be healthy during a heat wave. So there's lots of ways we can look at mutual action. These are the carbon emissions of the healthcare sector. So scope 1 is what we're sort of emitting directly in our facilities. Scope 2 is electricity, and scope 3 is everything else. So that's a big chunk. That's supply chains, that's transport, that's food and waste and all of those things. Big chunk. We're not going to spend too much time talking about this. Kate Charlesworth, who is from New South Wales, is an expert in many of the areas within this particular one, and she'll be doing a whole session looking at high quality, low carbon care, which is a big focus for us here in SA as well. That's kind of drawing from the fact that about 40% of the healthcare that we provide in Australia, and kind of going back to the fact that 80% of our carbon emissions in health come from clinical care, not buildings, but clinical care. 60% of that is effective care. 40% of the care we're providing, the carbon emissions of that care, is either low value or harmful care. So it's not doing anything good for our patients. It's costing money, and it's also creating carbon emissions. So that's things like tests we should not be doing, the CT we should not be ordering, maybe the person who did not need to go to hospital. And how can we address that chunk of care that we just need to be providing in a better way? Okay, this is really just to say the biggest thing we could do is invest in primary care and public health. Now, we're not going to go through all of the reasons that's very difficult and how federal politics plays into that as well, but we know if we did that and kind of shifted the weight more to transforming our models of care so that we were looking at more resources focused on prevention, we would have an 80% reduction in CO2, less pressure on our hospitals and less carbon emissions as well. So anything we can do to try and shift the needle in that direction within our health systems is a good thing. So if that's getting any kind of care out of a hospital and back towards providing it in the community, that's a good thing as well. And of course, a lot of this is investing in and supporting our GP workforce as well to be able to do their job. I'm just going to skip over this one. It's basically what we have just said. I'm going to end with some good news because this can be very depressing. So this is a quote attributed to Barack Obama, but I'm fairly sure other people have said it in other ways, that we're the first generation to feel the impact of climate change and the last generation that can really do something about it to keep warming as much as we can towards and below, hopefully 1.5. That's exciting. If you can say anything about climate change is exciting, is that we still have time to do this. We can do this, and there's opportunities to do this. So if we do this, it can look really exciting. I think we can rethink how we want our cities to look. We can move away from building lots of roads for cars and think about how do we invest in public transport and green spaces for people. What does this look like? What do we want our communities to look like and our hospitals? What do we want that to look like? Because in many ways, that kind of idealistic view, a lot of that is supporting what we need to do within healthcare and adaptation and mitigation. I'm just going to flick through a couple of happy good news stories and then I'll be done. So here are some good things that have happened. Costa Rica has reversed deforestation, which is pretty remarkable. So if you look at any of the work that Costa Rica is doing in climate change, it's pretty impressive. So they've managed to completely turn around from 1965 to reforest and rewild and have more of that green space than they did before. Paris is moving away from cars, so they've closed a lot of their roads, and now you can only walk or cycle them, and other European cities have done the same thing. There's certainly precedent. We know that renewables are way cheaper than they were, and in many places cheaper than fossil fuels. No longer an argument. So we don't have financial and technological arguments now against moving away from fossil fuels. It's also sociopolitical. We know that in SA, we're kicking lots of goals in terms of what we're doing with renewables. We need to move away from gas, but we're doing really well with solar and wind. And there's been lots of court cases that have kind of said internationally that countries have an obligation to populations and communities to really tackle this problem. Locally, we are doing this work I kind of alluded to before with Harvard, which is Climate Resilience for Frontline Clinics Toolkit. So we've got a partnership with them to roll this out for our GPs, emergency, community care, etc. So we're doing that. The Royal Adelaide has secured the world's first green and social loan. So they're doing a lot of things to meet that obligation as well in the sustainability space. There's lots of things happening within our health system in LHN. So we're connecting the dots, bringing people together. Most of the metro hospitals now have some kind of sustainability group that's meeting and doing lots of really good stuff. And there are lots of teams that are getting put together to tackle this big problem. We're looking to run a gloves off campaign across the LHNs, hopefully later this year or next year as well. And we are doing some work within the system about reducing unnecessary testing as well, which is a big part too. And lastly, on this slide, this is a group of people that I have had the privilege of working with a bit over the last few months, which is sort of across our health sector and emergency response, so CFS, SES, Department for Human Services, Red Cross, etc., looking at community resilience to climate change and how do we come together across all of our different agencies and really build this robust, socially cohesive response that protects communities and helps them thrive even when there's not a fire or a big catastrophe happening. And we still have time, I mentioned that before. And I'm going to skip over that just to say, if you want to do any of these things or get involved with any of the networks that are happening, have a look at the framework. If you have anything you want us to showcase or any ideas or questions, you can email that email address. So health.climatechange@sa.gov.au. And finally, that is my email address. So I'm sure I've only very briefly touched on some things that many of you'd like to explore in greater depth. Always happy for you to get in touch as well. And that is it. Thank you.